Welcome to this special edition of Global Health Matters Issues in Focus for Irish AIDS Day, June 15th. I'm Robbie Lawlor, I'm 26 and I am from Dublin in Ireland. So I guess I got into HIV and advocacy when I was diagnosed with HIV back in 2012. It was a very interesting time for me because I didn't know HIV existed in Ireland. So it was quite a shock of a diagnosis. And I guess if you don't know what HIV is, the diagnosis can be very heavy and can really affect your life. So once I started to realise that there's such issues around HIV, I realised that, do you know what, being a positive role model and a voice can really make positive change. So that's why I'm here, and that's why I wanted to explore advocacy in a really good way. So today I want to talk about, just to highlight a few issues about HIV in Ireland. So in terms of prevention, I think it's very important to talk about actually getting people to get tested for HIV. We know that we are notoriously bad for having late presenters. In 2015, 46% of all people diagnosed in Ireland with HIV were late presenters. So this means they could potentially be living years with HIV without knowing it. This can lead to things like disease progression, but also they're a lot more likely to pass on HIV. So what we need to do is get people to get tested. We need to make it culturally acceptable to go out and get tested regularly. And we need to get rid of the stigma and shame around getting tested. What we also need to fight for, though, is for more access to free testing services. And really push that as well. Another issue around prevention is that Ireland does not have access to PrEP. PrEP is pre-exposure prophylaxis. It's a HIV drug that is given to HIV negative people. What we know is if HIV negative people take this drug every day, and if they're exposed to HIV, they're a little under 100% chance of not contracting HIV. This is an absolute game changer. But yeah, Ireland is stalling getting PrEP in. We cannot wait anymore. We need it now, and we need it free for all people who need it, for those high-risk groups. But that's just prevention. For people living with HIV, we have big issues, but one of the biggest is stigma around HIV. I have met people through the years of all of the work I've been doing who have never ever told anyone about their status. They could be living with HIV 20 years, 15 years, 4 years, and they feel like they can't tell a soul. You can imagine how hurtful that is to the person and the stress that puts them under. And that doesn't need to be the case. Because from what I understand is, stigma is just bred from fear and ignorance. Because HIV is just not talked about. But what I also understand from all my work, and working with over thousands of young people, is that knowledge and compassion quenches that stigma. We live in a generation where if you're given a HIV diagnosis and you start medication, you will live as long as anyone else. And what we need to do is to explain the benefits of getting tested to people and push for that. And to say, here, listen, we're just looking after ourselves, we're trying to live our best lives, there's no need for stigma. And this is absolutely the message we need to push across. But those are the issues facing us here in Ireland. In middle-income countries and lower-income countries, it's a different story. For example, 46% of all people living with HIV have access to medicines. That means 54% of people living with HIV are not. And this is for many reasons. One is the high drug costs of HIV medication, and also the lack of political will for them to fund these medications as well. And if people aren't getting access to medicines, they're dying of AIDS. And if they don't have access to medicines, it's the spread of HIV. So this is something that we really need to focus on and to push for as well. Another issue is gender inequality. We cannot beat AIDS if we do not first confront gender inequality. We know that every time a young girl goes to school, she reduces her likelihood of contracting HIV by 12% every year. But yet this isn't a reality for so many young people around the world, especially in low-income countries. So what we need to do is we need to make sure that young girls get a good education. We need to stop gender-based violence, and we need to stop child marriages as well. Another crucial aspect that we need to push for is to increase bilateral funding into community engagement projects. We need to ensure comprehensive and compulsory sexual health and HIV education. And most importantly, we need to make sure that HIV stays on the political agenda. We have to hold our governments and civil societies account for political, financial and programmatic leadership. It's a combination of all of these approaches that are going to push us forward to ending AIDS and to achieving our Sustainable Development Goal of zero new HIV infections, zero AIDS-related deaths and zero stigma and discrimination by 2030. We'd also like to highlight an article series from the Irish Forum for Global Health Rights Programme, written especially for Irish AIDS Day 2017. The programme supports writers and advocates through training workshops and showcasing their work to the online audience. The series begins with Breda Gahan and Jennifer Schoonover, who write about the perceptions among young people and the state of HIV here in Ireland. Kevin Keane then takes us across the globe to India, where new legislation has been passed aiming to help overcome discrimination against people living with HIV. Trace Lynch explores the ways in which the changing landscape has brought HIV more into the public consciousness. But have we yet managed to shake off the stigma and shame experienced in the past? We also have two great pieces examining the pressing issues affecting HIV care. Laura Reaney looks at the contrast between care for babies born to mothers living with HIV in Ireland and abroad. And Aoife Kirk rounds out the series with a case study from Tanzania of the ways in which stigma can affect not just a person with HIV, but their families as well. If you are free on Irish AIDS Day, come along to Film Base in Temple Bar to the All Together Human exhibition. All the proceeds will go to our future campaigning to help have an Ireland without stigma. And if you want to get your regular checkup, I definitely recommend going to HIV Ireland, where they have a mapper of all the sexual health clinics and where to go and what time. So I definitely recommend going on that as well. I'd just like to thank you all for listening, and I hope to see you at the All Together Human exhibition today. And also, I just want us to reflect and think about how we can all come together and make sure that HIV is always on the agenda.